Happy Labor Day, everybody. We got a special edition eccentric protocol for healing Achilles tendonopathy. So if you're not familiar, eccentrics, which is active lengthening the muscle, is healing for tendons. And we'll go over why that is. Also, I got a new microphone, so hopefully it helps. Be patient. I'm still learning. So even if you've listened to nothing that I've said so far or nothing that I'm going to say about Achilles tendinopathy, this has been shown for healing. Even if you're not a runner, this has been shown in the evidence over the years to promote healing. Let's go over a little bit of the backstory. So with the Alfredson protocol, how was it created? Like a lot of good things, it was created by accident, myself included. I'm kidding. I'm not great. Anyway, so how this all happened was back in the 90s, there was and he's still alive, an orthopedic surgeon named Dr. Alfredson. And he had Achilles pain. And he said to his partner, he said, "Hey, will you do surgery on me?" He's like, "No, it's not bad enough. There's nothing to do surgery on. I'd have to see all your patients. No go." So he's like, "All right, I'm going to show this guy. I'm going to rupture this thing myself." So what does he do? He drops his heel off the edge of a step every single day trying to rupture his Achilles. He's fed up with it. He's like, "All right, well, if I rupture, at least there'll be something to have surgery on." So as you can imagine, lo and behold, after a few weeks, what happened? It started feeling better. So they've done research on this over the years and the protocol's been modified some, but really what it all boils down to is this fancy term, mechanotransduction. And what that is initiating healing with a mechanical stimulus or load initiates healing at a molecular level. So let's break it down. Let's make it a little bit easier to understand. So this is the analogy that I'll use with my patients. So back in November 2019, different times, I went and got allergy tested. I had it done when I was little, but I'm really into running. My asthma bothers me sometimes, and it's very allergy dependent. So I was like, you know what? I'm gonna invest in some time, and I'm gonna go get allergy tested. So I went, and this is what happened. They, gave me all these different things that I could potentially be allergic to, and if it had a reaction and to what degree, that showed I was allergic. And so what they do is they take this information, these are all numbered, and they say, all right, these are all the things he's allergic to. Let's make a concoction. Let's put this all in one vial, one sample, and then we're going to give him little bits over time. And then your body adapts to it. But here's the thing, if you give it too much, you have a reaction, anaphylactic reaction, you're breathing, it's not good. So you have to make sure you titrate and give 2 times injections, 3 times a week, and you change the dosage with time. This is over the course of years. It's a major investment. So what we're doing with this eccentric protocol or the mechanotransduction is we're giving our body, our Achilles tendon, what injured it in the first place, impact and loading, but we're going to give it in a certain dosage over time. We want to make sure we don't give it too much load too quick, because instead of the anaphylactic reaction, we're going to have pain or initiate that inflammatory effects again. So what bothered it in the beginning is what we're going to give in small doses over time. And that's why we have to listen to it when we do this protocol. And I'll tell you how I've kind of modified it over the years. It needs to be uncomfortable. There needs to be some level of pain. If I give such a small dosage that I'm not even going to build up the immunity to it, it's not doing a whole lot. And same thing, if I keep the same dosage the whole time, my body adapts to that. We have to keep increasing that stimulus. So the original protocol, and just like with everything, something happens, we change, we adapt with time, we learn more from it. The original one was 180 reps total a day. That was broken up into 2 sessions a day of 3 sets of 15 reps, both with the knee straight and with the knee bent, Tobias gastroc and soleus. 180 reps over the course of 10 to 12 weeks. That's a long time, that's a lot. It's not to say that's not right, that's been researched, that's shown to be helpful. But what I've done, just knowing what we know about histology and biomechanics and tissue healing, this is what I typically do. The dosage, we start off with 20 reps. I think 20 milligrams, whatever, 20 reps of the heel drops. Every day, pending our symptoms and our reaction, we're going to add 10. And that way we're increasing the stimulus slowly over time. There might be a day where you don't increase it because you gave it a little bit too much. It needs time to adapt to that. The durations can be for 8 to 12 weeks. So this is an investment, but it's a process. And I might have ruled out other things before this at this point to make sure if we're going to go through with this is what it's going to be. Like trigger points in the gastroc soleus, other potential things, low back pain that can cause Achilles pain. That's another day topic. And the frequency, I usually do 1 time a day. It can be broken up into 2, but this is all going to be dependent on your symptoms. So how do you know how many reps you're doing? How do you know what load is at your body weight? Do you take some body weight off? How do we know? There's a traffic light system that we follow. Green, yellow, and red. The pain scale is 0 to 10. 10, take me to the emergency room. 0, no pain at all. This is what we got. 1 to 2, we're groovy. We're green, yes. 3 to 4 out of 10 pain, proceed with caution. Greater than 5, 5 or greater, it's a no-go. All deals are off. So that's going to dictate how many reps you do. Let's say you're supposed to do 30 and you get to 25 and that pain continues to increase. And next thing you know, it's 6 out of 10. That was too much, shut it down. You repeat that same dosage the next day. Hopefully, ideally, you can now get to 30. And if not, you keep repeating that until your body gets adapted to that, staying under that 5 out of 10 threshold. One other huge point, this has been created over the years. If you've been following along so far, you've seen there's a difference in how we treat mid-substance versus insertional, both with a strength standpoint, but also big time, this is where most of this came out of, is with this eccentric protocol. We want to make sure, because we've learned tendons don't like compression. They don't like compression. So that's why when it came to the stretching, to stretch or not to stretch, if it's insertional and we're dropping that heel below neutral, as you'll see here in a second, that can cause more damage, more harm to that insertional pathology. So here's the differences, insertional versus mid-substance. 2 up, 1 down. And the reason for that is, if I'm doing a bicep curl, this is the concentric phase. The muscle is actively shortening. The eccentric phase, where it's lengthening, that's where the magic happens. That's where the healing properties come in. Grab a 50-pound weight. There's no chance you can lift it up on your own. If someone hands it to you up above or use your other hand to assist, you can slowly lower that down. So same with this. We're trying to assist up the concentric phase, 2 up, and then unassisted on the way down, that eccentric phase or that active lengthening phase. So catchy, 2 up, 1 down. Here I'm mimicking a left Achilles pathology. And so you'll see here with insertional, we're stopping right when it gets to the ground. So I'm not going past that neutral. I'm not going into that dorsiflexion. That tendon's not wrapping around the calcaneus. Versus here, my heel is dropping down below neutral. So we're getting that wrapping. So this is okay if it's mid-substance, if that's where your location of your pain's at. But you can see here when that heel drops below, we're getting that wrapping effect. So that's the big difference when it comes to, if I have someone who comes in, they say, yeah, I've been doing these the negative protocol, the eccentrics, I'm not getting any better. Either one, they're not doing the right dosage, they're not doing it the right amount of times a day for the right period of time, they're not increasing the stimulus, they're keeping it the same, or they've been dropping their heel down below using a step, and it's insertional and just aggravating it. So start low, slowly build, listen to the traffic light system, and let's heal this thing.